Welcome, everybody, to this live stream from Mili. It's so nice to have you here. Thanks for spending a little bit of your evening with me. My name is Alison Waldman. My pronouns are she, her. I am the wellness provider at Mili. If you don't know about Mili, we are a new virtual platform to support cancer patients through wellness, nutrition, and mental health. And I'm here today to share a little bit more about what it means to have a wellness practice as a cancer patient or survivor, and how these practices can support you in any part of your diagnosis, can support you and your loved ones and your caregivers. On Mili, we provide guided meditations, private one-on-one yoga sessions, and a public Yoga for Cancer class, which is on Wednesdays at 5:30 p.m. Eastern, right on the platform. One of the many reasons why yoga and meditation are a tool for patients and survivors is that it gives a sense of agency. Yoga can be a tool for that agency, a tool for mobility. I know that cancer can be immobilizing, and connecting to our breath is a way that we can find places to move where it feels like there's nowhere else to go. Ways to remember what you do have control over in that moment, and to take control over your breath and over your thoughts. This evening, I'm going to lead you through a short demo of some meditation and gentle yoga practices that you might see in a Yoga for Cancer session or class or meditation session on Mili. We'll do a little bit of moving, a little bit of breathing. And when I'm done, I'll open it up to answer some questions. Any questions you have about Mili as a platform and why yoga, why meditation, and why our yoga and meditation that we offer on Mili. You can participate in this demo from anywhere. I'm sitting down on the floor on my yoga mat, but you can also do this sitting in a chair. If you're sitting on the floor, I encourage you to elevate your hips. See, I'm sitting on my pillow here. Elevating the hips can help the hips soften, the knees be relaxed, but most importantly, to find a tall, proud, majestic spine. So take a moment to set up in a sitting position that feels good for you. We're going to be here for a little while for this demo, so it's most important that you are comfortable. You'll notice that I have some props here. We utilize props in a lot in this yoga practice for cancer. One way you might want to use them if you're on the floor is to put something like blocks under the knees to help support them. If you're curious about what kind of props you can use at home if you don't have a pillow or blocks, feel free to ask that in the Q&A or come to class and see how you can be creative with what you have in your space. So sit up nice and tall and find the hands on the torso, one hand on the chest and one hand on the belly perhaps. Let the elbows be soft and the shoulders drop. And I invite you to close your eyes or take a soft gaze over the tip of your nose. Begin to tune in and focus on your breath. Letting go of judgment or expectation about what's about to happen or what the breath is supposed to be like. It's not supposed to be like anything. Just the way it is right now is how it's supposed to be. Feel the rhythm of your breath, the pace that it sets for you. Breath is such a powerful tool for our body and for our minds. For example, here in a posture that can look and feel like stillness, With the breath, we actually find there's so much movement as a part of it. As we inhale, we inflate in the front of the body into the hands. We maybe grow a little taller in the spine. And on the exhale, there's an opportunity to soften, let go of anything you don't need for this moment. Let the breath get a little bit deeper now. Take this moment for yourself. Finding movement in what can be perceived as stuckness or stillness. With this powerful tool of the breath, we're pumping our heart, our lungs are moving, our diaphragm can pump lymphatic fluid throughout the body, keeps everything healthy and moving. Take a moment to set an intention for yourself or settle on a mantra or an idea that brings you peace. It can be a dedication, a color, something without form, or some words. Invite it in through the inhales. As you inflate and as you exhale and soften, let it settle into your bones and muscles and skin and heart. This feels really nice for you. Feel free to continue breathing just like this. Or you can join me in some gentle stretching, adding breath to movement. This is a big part of how we practice yoga for cancer patients and survivors, connecting breath with movement to build muscle mass, bone mass, to keep that pump moving and to find resilience. So we'll bring the hands down onto the knees and inhale, draw the shoulder blades together and open up the chest, cresting the chest between the shoulders, feeling a nice sense of lift, growing light. And on the exhale, we'll round the back a little bit in this kind of Halloween cat-like rounded spine. This is called cat pose. Inhale, we'll come back to the middle and bring the fingertips onto the shoulders. And on the exhale, we'll bring one hand down. If you're on the floor, perhaps it finds the floor or your prop. If you're in a chair, you can grab onto the side of the chair and take a nice extension of the side of the body, moving the spine to the side. We'll inhale, come back to the middle, and exhale, soften to the other side. Inhale, come back through the center, a really gentle twist to one side, rotating the torso, let the arms fall down. Wherever they land is just fine. Inhale, come back through the middle, and we'll exhale, rotate to the other side. As we come back to the middle, take the arms up as high as they can go comfortably for you today. And on the exhale, we'll bring the palms together in front of the chest. Take a few breaths here in stillness. I'll lead you through the sequence a few more times. This sequence is all about spine health. It moves the spine in 5 directions. Bring the hands onto the knees. We'll inhale, draw forward. Nice opening of the chest, a big smile across the chest, maybe also the face if that feels right. Exhale, nice rounding, softening. Inhale back to the middle, fingertips onto those shoulders, a sense of lightness here if you can. Exhale, we'll tip over to one side, maybe let the head hang heavy. Inhale, come back up through the middle and go to the other side. Nice, soft, inviting side bend. Inhale back to the center. Keep breathing. We'll exhale, take our really gentle twist, kind of like wringing out the belly, helps keep things moving in the body. Inhale through the center, other side. Keep rotating, keep breathing. Keep being generous with yourself. We'll inhale, come back up, arms up as high as they can go comfortably, and bring the palms together. Let's do this one more time. Inhale, we'll open up the chest. Exhale, soften back a little bit more. Inhale, we'll come back to the middle, something a little different this time. As we tip over to the side, maybe turn this palm up and press up, like just for now, you're letting some anxieties and worries come off of your shoulders. We'll come back to the center and the other way. Just push those away just for now. Inhale back to the middle. We'll do the same twist, arms lower. Feeling light. Inhale back through the center and down. Take the arms up as high as they can go comfortably. Maybe that's just here for you today, and that's just fine. And we'll end with the hands now stacked on top of the heart. And give your heart some circles. Some thanks for moving the spine. Always good to keep that spine moving, to stay awake in body and mind. We'll end with some lymphatic massage. Lymphatic self-massage is something we incorporate a lot in the Yoga for Cancer classes. It's a way to first give yourself a little bit of tactile love, but also it helps move lymphatic fluid towards the center of the body to prevent swelling. It can sometimes help prevent and lessen the lymphedema that can often happen after surgery. So we'll start with the palm down and lightly, with some slightly pressed fingers, swipe up the arm and across the chest. You choose the amount of pressure you want to put here. Enjoy yourself. Go slow. Enjoy. It's all about giving yourself some love. Take one more like this with the palm facing downwards like this. And now we'll turn the palm up and bring the elbow as high as you can above the shoulder. Start the elbow, we'll press down through the armpit and then under across the ribs. Again, should feel pretty nice. Some lymphatic massage. Let's do it one more time. Last one, if it feels okay for you, maybe lengthen that arm and take one more big swipe all the way across. And let's add one more side bend. Bring this hand onto the floor and take the arm as high as it can go in this side bend. Ooh, over, over, over. Let's do the other side. Palm faces down. Some gentle brushing upward. This is a great time to connect with your breath. Know that in this moment, you are fully in control of your muscles and of your breath. Turn that palm up. We'll come to the elbow and the shoulder, some swiping down and across. Last one, the arm goes up maybe a little higher. Start at the fingertips. I'm blocked a little bit. You start at the fingertips, come all the way down, and end with one more nice side bend, nice opening, and down. Roll the shoulders out. Last thing, take the arms out wide. Take up lots of space. One thing yoga is really good with is giving us opportunities to take up space, to grow wide. Be present and assured in where you are. And give yourself a nice big hug. Give it a nice squeeze. Perhaps if you've been far away from family, or those you usually like to hug, you can imagine this as a nice big hug from somebody you haven't seen in a while. It's also really great for the lymphatic system, keeping our immune system strong. We'll open out and do one more time, maybe the other arm on top. Nice big squeeze. Have a little fun with it. Come on down. Check in with your breath. If you'd like to close your eyes again, maybe the hands come onto the torso. Just see, how has your breath changed from when we started? Listen to the rhythm. Every breath is an opportunity to invite in thoughts of peace and ease, even just for a moment, connecting the body and the mind. Can let the eyes blink open. That's the end of our demonstration. If you have some questions now, I can open it up to the floor. If you're watching here on YouTube, you'll probably be able to put something in the chat on, I think it's this side, wherever the chat is on the side. Any questions you have about yoga for cancer, meditation for cancer, and what we're doing on Mili. If you're not on YouTube, you can also text, if you don't have a YouTube account, to use the chat. Can send a text. The number has just been sent in the chat. Any questions for me that I'll be answering live for you right now? So I'm going to come over here just to look at my computer. I'm going to bring it into the screen a little behind the scenes. And some questions. I'm just looking at some chats. Oh, hello, everybody. Thank you. All right, Christian starting us off with some FAQs. Is it safe for me to do yoga if I've had lymph nodes removed? Yes, good question. This question comes up a lot, actually. The answer is yes. And one of the reasons why it's safe to do so is, as you saw in our demonstration, the yoga for cancer method that I teach through Mili is all about keeping the immune system healthy. It incorporates movements that help to keep the lymphatic fluid moving through the body, sending it back into the center of the body where it can do its thing to help clear out the immune system, all the bad stuff, and flush around all of the good stuff. There are some postures in yoga that can sometimes be troublesome to do if you have lymphedema or some issues, some swelling and lack of movement after perhaps sentinel node surgery or removing some lymph nodes. What's great about what we do on Mili and about the yoga for cancer method is that all of these postures are ones that have lots of variations if that's something you are experiencing, but also if you do a one-on-one, we have the opportunity to check in about your condition, to check in what surgeries you've had, how long ago you had your surgeries, what are the goals and hopes that you have for your yoga practice. So we can work around your conditions, including if there's a lot of swelling in an arm or a leg, some lymphatic massage to help alleviate that, and to find variations of the moving of the joints to help keep that part of your body safe. Other questions? I know we have a few FAQs lined up. Okay. If I'm having insomnia, can your wellness practice help with that? Yes, insomnia is something that a wellness practice through yoga and meditation in particular can address, because through breathing and connecting the body and the mind, this is different from a fitness routine, for example, because it connects the body and mind, which means that the movements that we do can help settle the nervous system. One of the causes of insomnia is that the nervous system is running a mile a minute, and there isn't a chance for that parasympathetic nervous system to kick in, the one of relaxation and safety. So what we do through our wellness practice is create a safe space and a place where we can breathe through anxieties, breathe through worries, and make space for that agency. And what else can happen, especially with our meditation practice, the guided meditations that we offer, particularly we do some 10-minute, I offer some 10-minute kind of mini guided meditations. And these are great for example, if you're in treatment, signing on and doing this during your chemotherapy or your infusion is you can walk away with some tools, some structures that you can take yourself through that are designed to help settle the nervous system and invite sleep in, to help connect with the breath and to find a sense of safety in your body and in your mind. And this is something that you can find both through a movement practice and the themes that we move through in a yoga practice, but also through the breath. I've had a number of people fall asleep during sessions that I've done in infusion units and even online and virtual classes. It gives an opportunity often for those who haven't felt safe or relaxed enough to fall asleep, gives them a structure and the permission to fall asleep. So, all said, if you choose to come to a meditation session or a yoga session on Mili, if you fall asleep during your session, I am not going to wake you up unless you want to be woken up. If that's not what you're here for, that's fine. But if that happens and that's something that you're happy about, then that's also yoga, in my opinion. If you're feeling safe and comfortable enough, then great. Enjoy that sleep. Thanks. Okay, great. Looks like we got a question from our text. Do I offer more active yoga sessions to help with flexibility and toning? Yes. So actually, the Yoga for Cancer method that I lead in our sessions has elements of a gentle restorative practice, but it actually is quite active. We incorporate the vinyasa technique, which simply means pairing breath with movement. So these postures, this was just a warm up that we did seated, but a Yoga for Cancer, particularly in our public class, but also those looking for active muscle mass and building bone mass and flexibility. There's a lot of engagement of the core. There's a lot of active movement. We're constantly in motion in a Yoga for Cancer class. We start with a warm up to get the body and the mind ready to go. We utilize props a lot to make our way to standing, to find some balancing poses, some standing poses, moving through breath, constantly in motion. And then we end nice and low to the ground and give the body a chance to restore. So that is a common misconception, actually, about a Yoga for Cancer class. So if you come for a one-on-one and you're looking for something gentle and restorative, then there's a lot of elements of this practice that we can incorporate in there. And if you're looking for something more active, then that comes in as well. The public class leans a little bit more towards active, all with the modifications and understanding of the needs and safety of someone who has been through treatment or is currently in treatment. Thanks, Jared. What role do you encourage partners to take while doing yoga with their loved one who has or had cancer? Thanks, Jared. I think if the partner feels comfortable participating in a Yoga for Cancer class, especially in virtual, which is what we do on Mili, I think that is one of the best ways to connect with your partner or spouse or loved one who has cancer. To move through a practice as a community, as a unit, is such a powerful experience. And that's why one of the tenets of Mili is building community and building a sense of togetherness and supportiveness. So participating in yoga class or in a meditation can be such a powerful tool. If participating is not something that is possible for whatever reason, I think asking your partner and spouse what they appreciate the most about their yoga practice, what they learned from class, if there's structures that you can help remind them to find moments for outside of their yoga practice. We teach a lot about being present and curious on the mat and through meditation, but my hope for any student who comes is that the yoga mat and the meditation seat is a toolbox and a place of learning, and that there's so many ways that you can incorporate that into your daily life. You can find a way to stretch, to reach up towards something on the shelf, or to find a moment of breath. And another specific one, just to answer your question, Jared, that I've also found has been great, particularly for the short infusion meditations, is to listen in or participate on those meditations. And those meditative structures, they're guided meditations, are something that are fairly easy to remember. And you, as a partner, perhaps if your loved one with cancer is having a hard time sleeping, you could offer to take them through part of that structure. You can help remind them of the parts of it that help them feel most safe and settled. And you can be the one to offer that when they're unable to come online and do it with me or with others. Great question. Thanks, Jared. Another question, many patients can feel anxious on the day before treatment and on treatment days. What part of your practice can help with that? Oh, and they prefer not to take medication. Yeah. A breathing exercise. In yoga, it's called pranayama, which simply means focused breathing. What we did at the very beginning of the demo this evening, bringing the hands onto the belly and focusing on the breath, bringing in a sense of concentration and almost like a task. It's your job in that moment to focus in on your breath. I think learning about some breathing exercises and some of those guided meditation structures are a really great way to help, again, settle that nervous system and to remember that sense of agency. I talk about this a lot. You heard me say it a lot tonight. It'll come up in sessions if you come and join me, is something that I recognize as a practitioner, as someone who has loved ones with cancer and has worked a lot with patients on site, is during treatment and during a cancer diagnosis, a sense of control gets taken away. And going into treatment, going into infusion, you're getting hooked up, you're getting things done to you, and you just sit there and let it happen. And what these breathing practices can do can help remind you, what can you do in that moment to ease your mind, to give yourself a pep talk, to remember what is still possible for you and what's worth sticking around for. So breathing exercises, meditative structures, and also related to Jared's question, I think having a loved one either come with you or to remind you of some of those structures that work for you, to let that be part of their role as a caregiver and a loved one, is to remind you that they have that. And if you have the opportunity to, if you have a great relationship with your nurse or your technician at your infusion center or wherever you get your treatment, your radiation or your infusion, is to let them know that you're practicing meditation and to ask them to give you a few minutes undisturbed if you need to do that for yourself. Grab hold of that agency. I hope that helps. Okay, so we are at the end of our time. If you have any more questions for us, if you're here through Mili, you probably got an email and have our information. If not, maybe Christian can put our website and an email address. We have an info@yourmili.com, I think, is our email address. Be happy to answer some more questions. You can find us on Instagram. We can answer some questions there. But I hope to see you on Mili. One-on-one sessions, our Yoga for Cancer group class on Wednesdays at 5:30 Eastern, and one-on-one meditations as well. I hope that this session, you leave the session feeling lighter and more hopeful than you arrived. Thank you so much for joining us this evening, and I hope to see you we hope to see you on Mili sometime soon. And stay mindful, stay moving, and stay well. My name is Alison Waldman. I will see you soon, hopefully. Good night, everybody.